Okay, hi everyone. I'm Dr. Cilio. I am your instructor for health behavior theory this semester. I'm going to take a little time to walk you through the health status worksheet, which is your upcoming assignment. This assignment, you can get all the details and the instructions in this overview and this first page that we're looking at, but I find that sometimes with online courses, it's helpful for us to provide, a little bit more information and these videos hopefully can help you, understand the expectations for the assignment. So I'll just kind of walk through basically all of the aspects of what you should be submitting for this. The overall purpose of this health status worksheet is for you to start to gather information that from the literature about your health behavior and health status that you're using for your final paper. And this should really be, it's designed so that you can take this information later and basically plug it into your final paper. You'll have done a lot of this literature review already. And by the time you get ready to write your paper, you'll have collected a lot of the information that you need to write the introduction. So it's really meant to be, building towards your final paper and a stepping stone towards it. So this paper or this worksheet, you will really be focusing on the health behavior and the health outcome that you were approved for. So you have sent me your different topics and I've given you approval for the topic that you're going to be focusing on this semester. So you should be focusing, you should sort of already know what your behavior is and what the outcome associated with it is. It's important in this assignment to know the difference between the two because there are aspects of it where you need to be collecting information about the behavior versus the status, and you don't want to confuse the two of those. So, for example, you might have been approved for something like smoking as the behavior, and the outcome or health disease, status that you're approved for might be, if it was smoking, it might be lung cancer. So we can use that example throughout. So basically, read this first page, gives you more of this background about why we're doing this and what the goals of this assignment are. We'll also be through this process identifying what your priority population is for that final paper. Your priority population is basically, who you're focusing on in terms of thinking about intervention and thinking about, how you can change this behavior in this population. So it should be a population that has maybe a high burden of either the behavior and or the outcome that you focused on. It could be one of just of particular interest to you. So for smoking, it might be specific, age group. It might be specific race or ethnicity group. It could be pregnant women. It could be people, with some comorbidities. So there's a lot of different ways you can narrow down a priority population, but it should be pretty specific. And you can also think about geographic location. So if you want to focus it on San Antonio in particular, that will help you decide what type of data to collect in this exercise. But we'll get to that as we go through this. So the first part A is gathering evidence of the burden or the scope of the health issue. So when we say health issue, we're talking about that health status or that health outcome. So in the example of smoking and lung cancer, this first page is focused on lung cancer, not on smoking. We'll get to that later. So what we really want is to know, based on what you gather here, what is your health topic, show me that it's an important health topic to focus on. What does the literature say? Why are you choosing this particular public health issue? So you should be pulling data that's showing me that this is a big concern in a specific area and that basically intervention needs to happen. So you'll first gather information on the prevalence of your health issue. and then your incidence. And so I have definitions here on the side column that differentiate between the two. So you should know the difference between the two. Prevalence being the proportion of cases in a population at a given time. So how widespread is the issue? So if we want to know the current prevalence of lung cancer in the United States, it should be something like, 5% of the total population have lung cancer in 2020. Or it could be not a percentage, but it could also be in like total number. 1 million people have lung cancer in the United States or in Texas currently. Incidence is the rate of occurrence of new cases. So this is the risk of developing the disease or contracting the disease. And this tells us whether it's increasing or decreasing over time. So you'll see that within each of these categories, there's different levels. There's global, United States, Texas, if applicable, Bayer County, and San Antonio. I have if applicable because you might have chosen something that you don't really want to focus your final paper on Texas or San Antonio. That could be, it could be just based on your particular interests. Maybe you have interest in global health and you want to focus on something internationally. And then in that case, you would be actually selecting a different country and then, potentially subpopulations within that country. But for most of your topics, it will make sense if you want to focus on Texas and to focus on San Antonio. So you want to collect as much information as you can within each of those levels. So I want to know globally how big of a problem is lung cancer, nationally, in Texas, and then locally. And I have here that they really should be from credible sources and have some examples of like the World Health Organization, the National Institutes of Health, the Center for Disease Control and Prevention, the Department of State Health Services in Texas, for example. US Census Bureau is another example. All of these are surveillance, they do surveillance nationally or locally. And it's the most reliable data you can find in terms of surveillance of health issues. So I want to see, you citing what you pull. Everything should have a citation. Put that citation in APA style. It can either be embedded within each section or it could come at the very end. But you should have in-text citations with a matching reference list. And you should make sure you always cite the primary source. So if you find a study that says smoking or says that lung cancer is the #2 killer of Americans, and they're getting that information from the CDC, I want to see the CDC citation. I don't want to see the article that you found originally that's citing it. I want to see who actually collected that data. That's really important. So that's a common mistake that I see made. Okay, so that's part A around the health issue or health, sort of disease or outcome. Next, we'll be selecting a priority population. So this is basically asking the question, who is this an issue for? Does it affect all subgroups equally? Usually that's not true. That's not the case. Like COVID, for example, while we're all susceptible to COVID and we all can get it, we actually see the burden of COVID-19 disproportionately distributed across socioeconomic status, across race and ethnicity, across geographic locations. So this is basically really starting to tease apart, that larger data of, okay, this is the overall prevalence. What's the prevalence in subgroups? Who's most affected? Where's the highest burden? This is going to help you decide who your priority population should be. Because, if lung cancer is extremely high in a certain subgroup and very low prevalence in, like, say, I don't know, like a certain race or ethnicity, it makes most sense to pick the group that has a great burden. You know, you should at least be able to justify with the data your selection. So you should be providing, you know, again, cited data that's showing me, you know, where we see the greatest burden of disease. An example, you know, African Americans are at higher risk for type 2 diabetes. Therefore, I would indicate that this is my population and explain why and show the data, statistics to support this. So you can see here is where you actually list my priority population is. But here you should have a whole bunch of data that you collect that shows the distribution of the burden of this disease or outcome. And then based on that, you can narrow it down and say, based on this information, I'm focusing on African Americans in San Antonio, given the particularly high rates of lung cancer in this population. That's an example. Here is just another, you know, I have here's just a little note about how there's also intersections within these subpopulations. So you can look at something by race and ethnicity, but you can also look at like gender within that or sexual orientation within that. So a good example of that is HIV, you know, by sexual orientation, we see greater rates of HIV infection among LGBTQ populations, in particular men who have sex with men, which we often refer to as MSM in research and programming. So that's one example of a subpopulation with greater burden of HIV is MSM. But then when you look at MSM by race and ethnicity, you see that it's within that category, it's still not equally distributed, right? There's still health disparities within that population. So we'll see that, you know, Black MSM, Hispanic MSM have greater rates of HIV than white MSM. So that's another good example of kind of looking at the intersections of these subgroups. Okay, so then I think we can move on to section C, where you're identifying and providing rationale for your selected health behavior. So again, you were already approved for the health behavior, so you could go ahead and write my health behavior is and fill it in there. So our example of lung cancer, the health behavior is smoking or vaping or, you know, whatever it is you're approved for. If HIV was your health outcome, you would have been talking about that in the previous sections. Now you're talking about maybe unprotected sex or HIV testing as the behavior that we're focusing on. So here's just an important, you know, like I said, I think students sometimes it takes a little while to kind of really understand what the health behavior is. And when you were picking your topics, there was some confusion about like what I mean by health behavior. They're actions taken by individuals that affect their health or mortality. So that action of unprotected sex affects their health or mortality or their risk of HIV, or smoking, for example, the risk of getting lung cancer. So that's what you're focusing on here. But first, you're going to identify all potentially modifiable health behaviors for your health problem. So for lung cancer, smoking is just one of those. Here, you're going to actually list if there's others and provide citations if there's others. Like HIV, for example, you have unprotected sex, that might be your health behavior that you chose. Provide a reference that supports that, but then add other ones. That's not the only way you can get HIV. So, you know, injection drug use is another one, for example. So all those modifiable health behaviors should be listed. And by modifiable, we mean things that are changeable, you know, so we don't mean race or ethnicity. We don't even really mean poverty or socioeconomic status because it's not something that we can easily intervene on. We want things that we can change through health behavior theory. And I encourage you to think outside the box. When we think about health behaviors, there might be some more things. Let's see. Actually, we'll get to that, I think, at the end. Come back to that. So anyway, you'll name your selected health behavior, and then you're going to provide rationale for your selected health behavior within your priority population. What's the prevalence and incidence of the health behavior within the population you selected? So if we selected Black MSM for our population because they have greater rates of HIV, now here I want to provide rationale for, I want to provide the prevalence and incidence of that health behavior, unprotected sex, for Black MSM. So I need to be providing some detailed statistics or studies that have shown, you know, what is the rate or prevalence of that in my population. If it was smoking and you picked, you know, Hispanics from San Antonio, you should be providing information on how prevalent is smoking among Hispanics. You know, maybe you can't find it specifically in San Antonio, but you might be able to find it nationally. So you're trying to get the data closest to your population to support it. Sometimes you can't find the exact thing you're looking for, so you find the next best thing. So here's an example. Tobacco use is highest among Native Hawaiians and other Pacific Islanders, who make up almost a quarter of US teens who currently smoke tobacco products. So this is, if you wanted to be focusing on like adolescent smoking, this is an example of, okay, what's the prevalence or incidence of smoking among adolescents, you know, in your population. So this is showing that. Then lastly, in this page is the evidence of the association or causation between your health behavior and your health status. So for example, smoking increases the risk of lung cancer by X%. Show me that there's a causal link there. You know, some of you submitted some health behaviors that I said were not closely enough or strongly correlated enough with that outcome. Maybe they are among many factors, but you know, this is why we want something that's actually strongly associated, that we know that if we could change smoking, we can reduce the risk of lung cancer. If we can change, you know, unprotected sex and get people to use condoms, we can reduce their risk for HIV. This is the purpose of finding this causal link. So this is an example of what the type of information you could collect. Pre-exposure prophylaxis, which is PrEP, or basically the HIV prevention pill, is 92% effective in preventing transmission of HIV. This would be showing my health behavior might be PrEP, using PrEP. My health outcome is HIV. This is showing that if you use it, it's 92% effective in reducing HIV transmission. That's the type of thing we're looking for here. So it might just be one statistic that you find, but it should be, you know, a reliable statistic with a reference. Let's see, other things on this page. I think that's pretty much everything, but you can read over these notes again. They're meant to help you. Now we're in the last section. Describe factors associated with or that influence your health behavior. So we have this divided by modifiable and non-modifiable. Non-modifiable are things that we can't change. Our age, our race, ethnicity, our socioeconomic status, that can change, but not through like health programming very easily, right? So I would personally put like SES or poverty in non-modifiable. Genetics, you know, actually a lot of these diseases have genetic, you know, factors. So just like family history, genetics, those are all non-modifiable, but they should be tailored to your health problem, and they should be tailored, you know, they can be general, but then if you have some that are specific to your priority population, you can make note of that. And then modifiable, so things that we can change. Now, when I talk to you all about your choosing of a health behavior, sometimes you sent me what I call determinants of that health behavior. And that's actually what you're looking for here, the modifiable determinants of your health behavior. So sometimes you put things like SES or access to healthcare or access to, you know, parks or healthy food. These are all things that we know. These are all things that we know affect health behaviors. That's the type of thing we're looking for now. So I have hint, think knowledge, motivation, skills, social support, social networks, access to resources, or other services, all things that can be changed. So if obesity is your health outcome, your health behavior might be healthy eating. But what affects your ability to eat healthy? That's what we're looking for here. Those are the things we're trying to identify. Those are things like, food deserts. Do you live in a food desert? Do you have access? What's your geographic sort of distance to affordable produce? That's one example. Also, education, knowledge, what do we know? What is an individual's sort of level of understanding about what good nutrition is? What's their motivation? What's their ability to cook a good, healthy meal? What's their support network like? Are they sort of, there's a lot of data out there that shows that our relationships matter, our partners matter, our friends matter, and they influence us in how we eat and whether we smoke or whether we exercise. Like I said, the built environment is something you can put here. So, and this should be comprehensive. In your final paper, you're going to make a model that maps this out. So the more you can find now, the better, because you're going to use it in your final paper. Again, with citations for everything. So that's really important, include the citations. And I think in general, a question you might have is like, how complete does this all need to be? I've gotten these back with like just single things in each section, and that's not really acceptable, and you won't get full credit if that's what you're giving me, unless it's really like the only thing, but I'll know if you are missing a lot of things. In this modifiable determinants, there should be a lot of things, and you can look in the literature. For this, I would look in the literature, not within the CDC so much as much as I would look within like Google Scholar and maybe PubMed. Look for peer-reviewed articles that have looked at like determinants of smoking among adolescents, for example, and that's where you'll get a lot of this information. See. So that's everything. I don't think there's anything else that I wanted to mention. Just gonna think for a second. Yeah, so basically as detailed as you can be, it's gonna save you time later, and it's going to make writing your final paper a lot easier. And you'll write all three of your discussion board assignments around this topic as well. So this is starting to get you to think about that. And if while you're working on this, you find that, I said I wanted to do injection drug use and hepatitis A. And now that I look at the literature, I really kind of am more interested or am finding more that supports maybe some different aspect of that. You can email me and shift directions, but just make sure you email me first because it needs to be approved, so I make sure that you're on the right track. Okay, so thanks. Email with questions or put them on the Q&A discussion board. Thanks.